Good afternoon, everyone. As part of the celebration of Nutrition Month, I am welcoming you all to this afternoon's lecture brought to you by Calamba Medical Center Facebook Live sessions. I am Roice Laigo, Clinical Dietitian of the CMC Nutrition Management Services. It is our mission to promote the best nutrition care for all our patients. Samahan niyo po kami ngayong hapon sa diskusyon na may temang Malnutrisyon, Patuloy na Labanan, First 1,000 Days Tutukan. Ang ating tema ay naglalayo na magkaroon ng sapat na kaalaman at wastong pamamaraan upang makamit ang wastong nutrisyon ng ating mga babies habang sila ay nasa sinapupunan pa lamang. At gayon din ang tamang nutrisyon para sa ating mga mommies. Mula sa National Nutrition Council, batid po sa atin ang abakada ng nutrition at ito ang mga sumusunod. A. Alagaan ang buntis. B. Breastfeeding kay baby. K. Complementary feeding na nasapat. D. Dapat lahat suportado ang Philippine Plan of Action for Nutrition. A few reminders po para sa ating lahat. All questions will be accommodated after the lecture, but you may type your questions at the comment section. And we will try to answer all your questions later. Don't forget to click like our Calamba Medical Center page para updated po tayo sa mga susunod na activities. Without further ado, it is my pleasure to introduce our speaker. Our speaker is a graduate of Doctor of Medicine at Pamantasan ng Lungsod ng Maynila, College of Medicine. Her residency training in General Pediatrics at PLM Hospital ng Maynila Medical Center. And a fellow clinical nutrition trained at St. Luke's Medical Center. Let us all welcome Dr. Racquel-Andaya.
Thank you, ma'am.
Welcome, Doc.
Okay. Can you see my slide na po?
Yes, Doctora.
Okay, so I'd like to thank first the CMC and Doc Gail for inviting me to talk to you about the first 1,000 days because of the theme for the Nutrition Month. So today's objectives are the following: to increase awareness on the effects of poor maternal nutrition during pregnancy, to understand the significance of good nutrition during the first 1,000 days, to know the current nutritional status among the Filipino people, and to know the existing interventions that we already have for prioritizing good health in the first 1,000 days. So let's start with knowing the effects of poor maternal nutrition during pregnancy. So, whether it be undernutrition, overnutrition, or micronutrient deficiency, malnutrition has many negative effects on the mother and the infant. So, this can be maternal anemia, preterm birth, postpartum complications. And I'd like us to focus on its effects in growth and neurocognitive development, which are your impairment of growth and development, growth restriction, poor cognition and behavior, and long-term adverse effects on both the mother and the infant. And this area is affected during the first 1,000 days. So this is the most active period of neurologic development, beginning at conception up to 2 years old. So children who do not get adequate nutrition, so kung poor yung nutrition from pregnancy up to 2 years old, it can lead to a lower IQ, a weak immune system, and impaired brain development. And I'd like us to focus on the long-term consequences of poor nutrition in the first 1,000 days, which are your lower IQ can lead to poor school performance and eventually a low economic productivity. There is also an increased risk for diet-related non-communicable diseases like your diabetes, obesity, and hypertension, which also result in lifelong medical expenses. So, lalong hihirap yung ating bansa because of poor nutrition in the first 1,000 days. So among children, chronic malnutrition is reflected by stunting, which is defined by a Z-score of less than -2 when we plot it on the WHO growth chart. And during the 2019 expanded National Nutrition Survey, it was found that 1 out of 5 children is stunted or bansot. And among pregnant women, 22.9 are actually nutritionally at risk who will deliver to low birth weight babies. So it will be a cycle of poor nutrition. So nutrition-specific interventions have already been existing for prioritizing your nutritionally at-risk populations, which are the adolescent girls, pregnant women, mothers, and their children. And in this Lancet series in 2013, they have enumerated key proven practices or programs that have been proven to be effective against maternal and child undernutrition. So these programs focused on preconception nutrition, so during pregnancy, good nutrition during pregnancy, micronutrient supplementation, food fortification, breastfeeding, complementary feeding, and disease prevention. And in our country, we have the first 1,000 days law, which became a law in 2018. And this was passed to address the problem of early life malnutrition. It is also known as your RA 11148. In the next slides, we'll be discussing the nutrition-specific interventions to improve nutrition in the first 1,000 days. So let's begin with the adolescent girls who are the 10 to 19 years old, or the women of reproductive age. So what we do with this in this population, we give weekly iron folate supplementation to these adolescent girls. And during pregnancy, because the need for vitamins and minerals increases, we want to consider if the pregnant woman is able to consume adequate diet. If she is able to consume or not, then we may give multi-micronutrient supplementation or multivitamins. But as a minimum, all pregnant women should receive this for folic acid, vitamin D, calcium, and iron. But for calcium, we want to consider the intake of dairy products in these women. So kung yung pasyente is able to consume mga 500 ml of milk product per day or 1,000 milligrams of calcium from other sources, we may not give calcium supplementation. But if not able to consume this, we will need to give 500 milligrams of calcium once a day throughout the pregnancy. With regards prevention and control of iodine deficiency disorders, we have already addressed this through the universal salt iodization. And in the Philippines, we had the ASIN law in 1995. While for women, the recommendation is for sodium intake that is not excessive, but also not below 2,300 milligrams of sodium per day. So your 2,300 milligrams is equivalent to 1 teaspoon of salt or isang kutsaritang asin per day. So it should be the minimum. With regards prenatal visits to ensure good outcome, those who have normal or uncomplicated pregnancies, we'd like to recommend them to do at least 4 prenatal visits. While if the pregnancy is high risk, we need more than 4 visits for the pregnancy, the duration of the pregnancy. Also, part of interventions or programs are maternal supplementation with balanced energy and protein, which includes education and counseling on proper nutrition. And a simple way to explain a balanced meal to our patients is by the use of the Pinggang Pinoy. So using this illustration, we can give your patients an idea of the proper proportions of our Go, Grow, and Glow foods. And we need to advise our patients to consume a variety of foods. So iba-iba, diverse, and nutrient-dense. And to avoid sugar-sweetened beverages. So soda, yung mga juices, which are not made of fresh ingredients, we want them to avoid this type of food and beverages. So sometimes we tend as the primary care physicians of these women, we tend to just tell them na to consume 1,800 calories or lakasan kumain or i-avoid itong mga pagkain na ito. But sometimes we may need to use equations to estimate energy and protein requirements. So we want to calculate their actual requirements. And in doing so, we must consider the pre-pregnancy weight, whether normal yung BMI nila, low or high. We also want to consider the physical activity of the mother and the pregnancy energy deposition, which is about 300 to 500 calories during the second and third trimester. With regards protein, we want to give 20% of the total energy to be protein. And for every fetus or every additional fetus, we will add 25 grams of protein per day. So kung kambal or triplets, that's an additional 25 grams per fetus. So it is not enough that we educate our patients on proper diet, but also to tell them to do physical activities and to ensure adequate weight gain during pregnancy, because it will actually improve outcomes in these pregnant women. So sometimes we fail to monitor the weight of our patients, and the Institute of Medicine made this recommendation for prenatal weight gain goals in consideration of yung timbang na mga nanay bago sila magbuntis. So for example, in this list, for a mother with a normal pre-pregnant BMI, the expected or recommended weight gain is about 11.5 to 16 kilograms or 0.4 kilos during the second trimester. That's 0.4 per week. So this is the recommended weight gain for a normal BMI. We expect or we recommend less for those who are obese or overweight. And finally, for our patients, because we are the first ones to see them as their primary care provider, we'd like to identify pregnant women who may be at nutritional risk. So these are the women with anemia, poor gestational weight gain, those with inadequate diet because of restrictions like vegan diets, diabetic diets, and those who have pre-existing medical conditions like GDM and hypertension. So as the care physicians of these patients, we'd like to consider to optimize their conditions and consider multidisciplinary management. So consider referring them to other specialists like your dietitians, endocrinologists, and other specialists to optimize their condition. Moving on to lactating mothers, it was found that breastfeeding mothers in Metro Manila have inadequate intakes of iron, folate, vitamin B6, and protein. And in this same report, the top 15 most consumed food of breastfeeding mothers is indicated in this chart. And we see here that the least consumed food in among breastfeeding mothers are your dark green leafy vegetables, which incidentally are rich in iron and folate. So in estimating their requirements, we like to consider the milk energy output and weight loss. So during the 0 to 12 months postpartum, we add at least 400 to 500 kilocalories to their diet. But please remember that although these equations estimate the energy requirement, we'd like to consider first the body weight of the patients, whether during the postpartum period they are gaining weight, losing weight, or not gaining at all. So we want the relative body weight to be our indicator of energy adequacy, whether we'd like to adjust our provisions kung magdadagdag ka or magbabawas ng pinapakain mo sa pasyente. With regards micronutrient supplementation, again, some people, such as those with restrictive diets, may not get adequate nutrients through their diet alone. And especially because breastfeeding increases the need or the requirement for some nutrients like iodine. So for those infants of mothers who prefer to maintain their vegan diets, we may need to supplement with vitamin B12 because of their risk for vitamin B12 deficiency. And in the same way that we recommend multivitamins among pregnant women who do not consume adequate diet, we'd like to give this as well to our lactating mothers who are not eating a diverse diet. So for food that mothers should avoid or limit while breastfeeding, generally, they do not need to limit or avoid specific foods, but as long as they are able to consume healthy and diverse diet. But for some, to avoid mercury consumption that we can get from seafoods, it is recommended by the US FDA to eat a variety of fish per week and to try to avoid eating the fish listed in the orange box. So, konti lang naman ito. Your mackerel, marlin, shark, swordfish, big-eyed tuna. So, these are the fish with highest mercury levels, and we'd like to avoid them while pregnant and breastfeeding to avoid mercury content. And for those who consume coffee while pregnant or breastfeeding, we may need to restrict caffeine to about 300 milligrams per day or less, and that's equivalent to 3 cups per day. For interventions among neonates, we have been advocating the unang yakap or EINC, and part of it is delayed cord clamping. And this will result to a significant increase in newborn hemoglobin and serum ferritin, which will prevent your neonatal anemia. And for preterm or yung mga small for gestational age babies, we do kangaroo mother care for promotion of early breastfeeding and support to the mother and child. We also do vitamin K administration among these neonates to prevent bleeding at birth. And I'd like to emphasize newborn screening, which helps us to identify neonates or newborns who have inborn errors of metabolism, because these patients will require specific or special nutrition therapy, which are also called medical food. These patients are those with phenylketonuria, maple syrup urine disease, and galactosemia, and they may need special formulas to thrive or to prevent intellectual impairment and even death in these conditions. Of course, immunization will prevent childhood diseases like pulmonary tuberculosis and hepatitis B. For interventions in children and in infants and children, we'd like to promote, apart from exclusive breastfeeding, is also to start breastfeeding within the first hour of birth, because this has been proven to reduce neonatal mortality by 44%. So, unang oras ng pagkapanganak, we'd like to start breastfeeding and to continue with exclusively for the first 6 months, after which to continue breastfeeding up to 2 years of age or beyond, even if we have started complementary feeding. We also want to give a diverse diet to among this population. In the same 2019 nutritional survey, it was found that we had a low adherence to the infant and young child feeding guidelines. And among the top complementary food that is being given to our patients are your commercial baby food, which is quite expensive. And in this list, we see that we hardly provide protein sources. So walang egg, meat, or fish in the list of complementary food that is being given to our 6 months to 23 months of age babies. So to achieve a diet or a diverse diet, we need to provide or consume at least 4 out of the 7 food groups, plus your breast milk. So these are your food groups. For example, in this meal prepared for a 1-year-old child, there is cheese, egg, potatoes, peach, and avocado. So that's 5 out of your 7, plus the breast milk. And this is a very good example of a diverse diet. So recently, the FNRI released the 2021 Menu Guide Calendar to help us or guide us in our preparation of complementary food. So these recipes are easy to follow and uses locally available ingredients. And it also is very important to note that all meals were added with the multi-nutrient growth mix powder that they have developed, and it contains 6 micronutrients: calcium, iron, zinc, iodine, vitamin A, and folate. So these are very nutritious complementary foods that you can give your children. So other products that have been developed to improve nutrition are your Big Mo or Rice Mungo Sesame Blend. This is a ready-to-cook baby food that has 130 kcal and 4 grams of protein. There is also MNERC or ordinary rice that is fortified with iron, zinc, vitamin A, B9, and B12, which is very good for pregnant and lactating mothers. And of course, we all know the Nutribun, but this one is in carrot variant. And one bun has 504 calories and 17.8 grams of protein. so packed with nutrients. And for those who have already transitioned to solids, we can give the rice munggo curls or the brown rice bars to ensure or to provide healthy alternatives for our children. So all the previous interventions that we mentioned help the child to develop a healthy gut microbiome. And it is very essential because a healthy gut during early life plays a critical role in the immune system of the child, as well as endocrine, metabolic, and other host developmental pathways. And in the image on the right, we can see factors that have desirable impact on the gut microbiome. And it starts with a healthy diet during pregnancy, term vaginal delivery, breastfeeding, a healthy complementary feeding, as well as an interaction with the nature, so biodiversity. All this result to the development of a healthy gut microbiota. For other interventions, we do the micronutrient supplementation. The Philippine Pediatric Society recommends vitamin A prophylaxis to reduce all-cause mortality by 24% and diarrhea-related mortality by 28%. So we can start it at 0 to 6 months up to 2 years old. And for iron, because breast milk has very minimal iron content, we can start supplementing our term newborns or term children at 6 months old, while for those who are preterm or low birth weight, we can start as early as 2 months of age to give them to prevent iron deficiency. And for zinc, for those who are at risk, we can give a daily dose of 10 milligrams zinc for 6 months. Again, immunization is very important for vaccine-preventable childhood diseases, and it is also important to prevent and know how to treat acute malnutrition or your severe acute malnutrition and moderate acute malnutrition. It starts with counseling and education on the importance of exclusive breastfeeding and proper complementary feeding. And if we are able to identify children who may be at risk or are already having some form of acute malnutrition, we need to be able to treat these patients at the community level by providing them with your ready-to-use therapeutic food or RUTF and ready-to-use supplementary food. So these RUTFs have been proven to provide faster rates of weight gain and 51% greater likelihood of recovery in these children. Other interventions are your disease prevention and management, which has an effect on the health and nutrition outcomes by reducing the burden of infectious disease. This includes your wash interventions or water sanitation and hygiene interventions. That includes your safe food handling, access to clean water, hand washing, and safe and sanitary spaces. Maternal and child deworming also will prevent disease. Immunization, like mentioned earlier, newborn screening will improve outcomes in patients who are found to have inborn errors of metabolism. Improved feeding practices in diarrhea or during illness, as well as zinc therapy in patients with diarrhea will all improve our or will all reduce the burden of infectious diseases. For our indirect interventions or nutrition-sensitive interventions, these are programs that are implemented at large scale and can be effective at reaching poor population. So the government and the private sectors need to boost our agriculture to reduce poverty, hunger, and malnutrition in the long term, especially in the poor areas. They also need to do social safety nets or programs that distribute transfers of cash or food to low income households. So these are programs like your Rise Against Hunger, For Peace, the community pantries and feeding programs, school feeding programs, which can all um, uh, alleviate difficulty our in the poor populations. For child development, early child development, such as in the psychosocial stimulation and responsive feeding, these are all effective to improve cognitive development. And we want to encourage verbal and nonverbal communication between the mother and child, show child appreciation, and provide support to our mothers who may be sick, tired, or depressed as well, so that we can provide good early child development. And again, lastly, education or schooling, which is a very strong determinant of the next generation's nutrition. Because parental education is associated with improved child nutritional status. So for our key messages, please remember that poor maternal nutrition have short and long-term effects on both the mother and the child. And the first 1,000 days of life gives us a window of opportunity to establish optimum health, growth, and neurodevelopment across the lifespan. For existing programs or interventions, we need to have the government and the support of the private sectors to prioritize health and nutrition in their policy making and budget allocation. So this is my last slide, and please remember, good nutrition during the first 1,000 days is a good opportunity for optimum health, growth, and neurodevelopment across the lifespan. So thank you very much for your attention.
Okay, Dr. Andaya, thank you po again for that very comprehensive. Marami po kaming mga terms na first time marinig. And so the floor is open po para sa ating mga questions. Ayan. If you have questions ngayon po, you can type it here at the comment section. So type nyo doon para mabasa po namin. And so we could at least maisama natin yung questions niya. Okay, so we have here questions po sent through message po. So okay lang din, we could entertain din po. Okay. Doctor, ito po yung first question niyo po. Okay na po?
Okay po.
Doctor, is it advisable po ba to give formula milk to babies if hindi makaproduce ng breast milk ang mom?
Okay. So, first, let's start with saying that breastfeeding is always the best for your babies, though. But we cannot always expect, hindi natin pwedeng expect lagi na especially first-time mothers na makakaproduce ng milk or enough milk to provide their infant. So minsan mas masyadong konti that our babies parang hindi sila nasa-satisfy. So if our only option is to provide formula, then we can give the formula. But again, we need to do measures, or kailangan may gawin tayo to improve our milk supply, because again, breastfeeding and your breast milk is always the best milk option for your newborns. Pero ayaw natin sila magutom. So kung wala kang choice, you can give formula.
Okay, Doc. Thank you po. Sabi nga po nila, fed is best. Okay, so next question, Doc, is any tips po for picky eater toddlers?
Well, for picky eater, we need to we need to determine, is it really anong reason bakit picky eater yung bata. So it will maraming factors. It starts with your development, yung environment sa bahay, feeding practices na ginawa ng nag-aalaga, the mother or the caregiver. So lahat po yun we need to consider before we can actually give intervention for picky eaters. But kung picky eater per se, we can start na dahan-dahan mag-introduce ng mga pagkain that we know are healthy and nutritious. Pero it comes with parang it's a systematic process, and sometimes we may need to ask for the help of our developmental pediatricians, as well as your mga therapists, occupational therapists, to address the problems of a child who is said to be a picky eater. Kasi baka hindi lang ganun kasimple yung problem. We need to address that holistic. So, ayun. Thank you.
Okay po, Doktora. Thank you po. Next question po is, if nag-positive po si Mami sa COVID-19, is it okay po ba na ipagpatuloy ang pagbe-breastfeed?
Another question, Doktora.
Opo. Yes. Again, sa ngayon, no, well, parang hindi pa naman nagbabago yung recommendation of the Philippine Pediatric Society and yung stand nila, policy, yung statement about breastfeeding in COVID-19. So, still, the benefit of giving your breast milk or continuing breastfeeding is higher than the yung negative effects na makukuha natin if COVID positive yung mother. So ang recommendation is to do your hygiene, hand hygiene, malinis din yung dibdib, tapos the mother should wear a mask while doing the breastfeeding. But so far, wala tayong reason to stop breastfeeding or giving your breast milk to your babies, even if you are COVID positive. Thank you.
Okay po, Doktora. Thank you po. Okay. So, Ma'am Lisette. Okay.
Okay po, Doktora. I think may last questions po dito na medyo very timely po ata ito. Okay. So yung question po dito is, if ang mami po ay nagkaroon ng COVID during pregnancy, possible po ba na mahawa ang baby?
Okay. So far, what we know about COVID is that it can be transmitted sa hinga. So, airborne or sa hangin. So, if we will not practice yung ating mga proper na sa hygiene, wearing of our mask, then we will possibly infect the baby. Pero kung from the breast milk itself, parang wala pa akong nabasa that COVID-19 can be transmitted through your or transferred through your breast milk. So, ang importante when you want to continue or to do breastfeeding or to provide breast milk to your baby, to do your proper hand washing, to wear your mask, and that's it. Parang walang walang reason para itigil yung pagbe-breastfeed if you are if you had COVID-19 or if you have COVID-19.
Hello, Doc. Ay, meron pa po pala last. So, from Facebook, may nag-ask po is, hello, Doc, meron po bang special nutrition needs for those who got pregnant in their teenage years?
Okay, so our teenage moms, una, hindi pa developed yung mga katawan nila. So, para rin sila mga bata, no? So, they still need a lot of nutrients. So, for like what was mentioned earlier, we want to do iron folate supplementation in the teenage population para if they become pregnant accidentally, somehow meron na silang parang nakapag-bank up na tayo with your iron and folate. But if they become pregnant already, then if they are not consuming a healthy and adequate diet, we may need to give multivitamin supplementation. So, yun yung kung hindi sila nagko-consume ng maayos na diet, multivitamins ang ibinibigay natin. But basically, yung folic acid, vitamin D, calcium, and iron are all needed in all pregnant women. So, ayun po.
Okay po, Doc. Thank you po. So, parang last na po yung questions na yun. So, Ma'am Lisette. Okay.
Okay. So, thank you po again, Dr. Andaya, for really helping us with some of our questions. Talagang marami po talagang mga ibang mothers, especially the first-time mothers, asking for advice usually for the health of their babies. So at this point po, we will now present the certificate of appreciation to Dr. Andaya. This certificate of appreciation is proudly presented to Dr. Cainap-Andaya. Grateful acknowledgement and sincere appreciation po for contributing immeasurably as a resource speaker of the 47th Nutrition Month celebration entitled Malnutrisyon Labanan First 1,000 Days Tutukan, given the 16th day of July 2021 at Calamba Medical Center, Laguna via Facebook Live. Signed by yours truly po, Ms. Mariel Sevilla, our Chief Nurse, and Dr. Catherine Juliano Remolino, our Chief Medical Officer. Okay. So, again, a virtual round of applause po for our speaker. Thank you po so much, Dr. So, keep online po kasi may mga susunod pa po tayong videos na ipapresent today. At before we end the session, so we had some of our mga creative moms who submitted their videos for the Nutrition Month cooking contest here at CNC. So mula po sa mga sumali, salamat sa mga nag-effort, sa mga nagbahagi ng idea nila sa pagluluto. So let's all watch yung mga videos na meron po sa ating page. So i-play po natin yung mga nag-submit ng videos. Okay. So once again, thank you so much for all these 3 videos submitted. Sila din po yung top 3 among yung mga sumali po. What they wanted to share was yung way of cooking that can be good for mothers also, and future para sa paglaki din ng anak nila, they could give those food po para po sa kanilang mga anak. Okay. So, ngayon din po, in behalf of course of CMC Nutrition Management Services, nais po namin magpasalamat sa aming management po, most especially kay President Jose Juliano, na Dr. Gerard, Dr. Joji, Dr. Racquel, Dr. June, our Chief Nurse Ms. Mariel, of course si Sir Mark, our marketing team. Thank you so much po sa lahat po ng mga support ninyo. Salamat po sa aming consultant, si Dr. Racquel Toralba, our clinical nutrition consultant po. And of course, those po na tumulong sa amin, the following teams who gave us support: the Abot Nutrition, Prestigious Caddy, Glucobest and Nutribest, and also Nestle. Okay, so again, we would like to give you this key takeaways po before po tayo mag-end ng ating session. If we recall po yung abacada, kanina po yung alagaan ang buntis. B, breastfeeding kay baby. K, complementary feeding na sapat. At D, dapat lahat suportado ng ating Philippine Plan of Action for Nutrition. Because importante daw po ang 1,000 days para sa health ni baby, starting po from the womb hanggang po sa kanyang pagluto. Okay, so nawa po magkakita-kita rin po tayo sa mga susunod pa nating events dito sa CMC. Please do not forget po to like the page, Calamba Medical Center, and get the latest updates of our healthcare activities. Okay, so please watch out our announcement po pala. We are gonna show it here. Don't go away pa po. Ayan. So we will be sharing po pala yung mga naging message po ng ating cooking video winners. This is from Miss Marvy Volvanco, malunggay cream pasta. Para daw po sa kanya, it is a healthy merienda for everybody because of its primary ingredient malunggay. So marami po siyang shinare about the good benefits po of malunggay. So sabi po niya, truly malunggay is my go-to galacto-grow and best friend. Of course, yung next video presented po, the veggie chicken fingers, next to the video showed. Ayan, it's from Athena Trinidad Agon. As a first-time mom, I need to ensure the health of my baby. Kaya ngayon pong ako'y buntis pa lamang, nag-iisip na ako ng mga maaari ko pong ipakain sa aking baby habang pinagpapatuloy ko ang pag-breastfeed. So, mahalaga daw po sa kanya ang breastfeeding and shinare po niya yung kanyang recipe which is good po in vitamin A, iron, calcium, and so on. So, lubos po siya nagpapasalamat syempre sa Calamba Medical Center para sa pagbahagi ng kanyang recipe. Of course. And the last recipe shown was Siya Malunggay from Lauren Perez. Okay. So bilang first-time mom, pinagluluto daw po niya si baby ng nutritious food at madaling i-prepare ang kanyang recipe na Siya Malunggay. So ito po yung nakakatulong sa lactation niya at sobra po ang pasasalamat niya sa Calamba Medical Center sa platform na binigay niya for the recipe or cooking video demonstration. So dagdag awareness po ito para sa ating mga mommies. So from this po at yung mga iba pa pong sumali, this video showed po our top, ang tawag dito, yung grand winner po from all those videos presented is none other than the Malunggay Cream Pasta by Marvy Volpango. Congratulations po, ma'am. Yes. So may premyo din naman po ang mga iba pa pong sumali. You could claim your prize po weekdays po sa aming clinic sa Tower 3. There you go. So yun po. Also, I take the opportunity pala ngayon para medyo i-promote na din ang nutrition management services po. We have diet counseling, calorie counting, medical nutrition therapy po, and of course, we have our consultants po, internal medicine, clinical nutrition, Dr. Gail Turalba, and for lifestyle medicine, Dr. Dex Macalinsal. So please contact us at 0999-568-5405, cell phone number and Viber number, and email address po as shown in the screen. And visit us at Tower 3 Diabetes Care Center, ground floor, weekdays 8 to 5 po. Okay. So I guess we have reached the end of this session. Okay, nawa ating pong baunin ang mga mensaheng binigay sa atin today. And again, please don't forget to like the page Calamba Medical Center to get the latest updates po of our healthcare activities. So ako po, si Lisette Quilloy, Chief Dietitian.
And ako naman si Roice Laigo, Clinical Dietitian.
at sama-sama po tayo sa ating health journey, ating tandaan,
safe tayo sa
PMC. Salamat.
Thank you.